here ever heard the term duodenum? Sounds like a silly word, right? Unless you're familiar with human anatomy, my guess is you probably haven't heard this term, and I hadn't either, as I sat confused and scared in a hospital bed while a GI doctor explained my condition to me. Hi, my name is Aaliyah Ricks, and today I'm going to provide you with a broad introduction to vascular compression syndromes, specifically superior mesenteric artery syndrome, or SMAS. Becoming more informed about rare diseases such as SMAS can help foster empathy, promote awareness, and encourage further research to prevent misdiagnosis. As someone who has been struggling with SMAS for over 5 years, I have spent countless hours conversing with doctors about my condition and have done extensive research on this topic. Today, I will cover the basics and statistics of SMAS, its anatomy and treatment options, and explain why continued research and awareness is so vital. SMAS is a rare condition involving compression of the third portion of the duodenum, which is part of the upper small intestine just past the stomach, right there. It occurs when two arteries, the superior mesenteric artery and the abdominal aorta, compress onto the intestine, creating an obstruction. This obstruction prevents stomach contents from emptying into the jejunum, which is part of the upper small intestine, after the duodenum. This results in an inability to get proper nutrition, leading to weight loss and malnutrition. Weight loss and malnutrition then exacerbate the condition as it reduces the mesenteric fat pad, which is the fat pad that should be keeping those two arteries apart. So it's a vicious cycle. Pain from the compression is debilitating and can cause vomiting and stomach distension. The National Library of Medicine states that the incidence rate for SMAS is only about 0.013%. According to Oxford Academic, it was first discovered in 1861 during an autopsy, and since then only about 500 cases have been reported. Although it is an extremely rare disease, the mortality rate is as high as 33%, or about 1 in 3. There are a variety of potential risk factors and causes for SMAS, including recent surgery, chronic vomiting, surgical correction of spina bifida, and there is even a congenital relation, meaning that some people are simply born with the anatomy to be at risk. Here we can see this anatomy with the superior mesenteric artery on your left, the abdominal aorta on your right, and the duodenum in between. And on this side, we can see how the duodenum is compressed between the two arteries. We can also see this obstruction from a front-facing angle as shown here, and the obstruction is at the end of the duodenum. The first treatment option for SMAS is conservative treatment or weight gain in order to restore the mesenteric fat pad and hopefully decompress the intestine, relieving the compression. Because people with this condition can't typically eat in order to gain weight, a feeding tube is necessary. There are a couple of different types of feeding tubes, including an NG tube, which goes in the nose, down the throat, and into the stomach. And as you can see, I was having a great time with mine that day. And there is also a gastrostomy tube, or G tube, that is a surgical feeding tube in the stomach. Some of you might think it's odd that I'm wearing a backpack today, but that's because I have one of these tubes as shown here, and it carries the pump for my G tube. There are also versions of these tubes that go directly into the intestine. If a person, for whatever reason, is not tolerating tube feeds to the stomach or the intestine, then another option is total parenteral nutrition, or TPN, which is IV nutrition and IV calories in a PICC line, as shown here, that goes in the arm and into the veins as close to the heart as possible. If conservative treatment is unsuccessful, then the next option is surgical treatment. The National Organization for Rare Disorders explains that a duodenojejunostomy is a procedure that bypasses the obstruction. There are a few different types of surgeries for this condition, but unfortunately, none of them are 100% effective. This is an image from the Mayo Clinic, and the Mayo Clinic states that a delay in diagnosis of superior mesenteric artery syndrome can result in fatal malnutrition, dehydration, electrolyte abnormalities, intestinal perforation, and even sudden cardiovascular collapse. A lack of research and awareness results in patients like myself going misdiagnosed for years, leading to copious amounts of complications, medical trauma, and deaths that could have been avoided. January 28th is National SMAS Awareness Day, and I encourage you all to wear purple in support, the SMAS color, and donate to the National SMAS Research Awareness and support nonprofit organization. Today I have provided you with an overview of SMAS anatomy, statistics, treatment options, and explain why continued research and awareness is so vital. It is my goal that you will utilize this new knowledge not only for spreading awareness for this disease, but also to be more conscious of those around you who are suffering from rare diseases. That day that I mentioned where I learned the term duodenum was over a month into what would become an almost 6-month hospital stay for me. My initial misdiagnosis should have killed me. Instead, I stand before you today to encourage you to support survivors and honor those who have lost their lives due to SMAS.